Clinical Vignette 1, Chronic Bronchitis, Blue Bloater versus Emphysema, Pink Puffer. A 65-year-old male with a 30-year history of smoking presents with chronic productive cough for the past 2 years and increasing dyspnea. On physical exam, he has bilateral wheezing, prolonged expiration, and mild cyanosis. Pulmonary function tests show an FE1-FVC ratio of 65%. Chest X-ray reveals increased bronchovascular markings and cardiomegaly. Question: what is the most likely diagnosis? A. Emphysema. B. Chronic bronchitis. C. Asthma. D. Bronchiectasis. Correct answer B. Chronic bronchitis. Explanation: chronic bronchitis is defined by a productive cough for at least 3 months in 2 consecutive years. It is associated with hypertrophy of mucus-secreting glands, leading to increased mucus production and airway obstruction. Smoking is the primary cause. Why not A? Emphysema presents with minimal sputum, barrel chest, and pursed lip breathing. Why not C? Asthma is reversible and characterized by wheezing and eosinophilic inflammation. Why not D? Bronchiectasis is associated with chronic infections and dilated bronchi on imaging. Clinical Vignette 2, Centriacinar versus Panacinar emphysema. A 58-year-old male with a history of long-term smoking presents with progressive dyspnea and weight loss. He has no significant cough or sputum production. On exam, he has pursed lip breathing, hyperresonance, and decreased breath sounds. Chest X-ray shows hyperinflation, flattened diaphragms, and increased retrosternal airspace. Question: which type of emphysema is most likely present? A. Centriacinar. B. Panacinar. C. Paraseptal. D. Bronchiolitis obliterans. A. Centriacinar emphysema. Explanation: Centriacinar emphysema is strongly associated with smoking, affecting the upper lobes due to increased oxidative stress. It results in dilation of the respiratory bronchioles, sparing distal alveoli. Why not B? Panacinar emphysema is due to alpha-1 antitrypsin deficiency and affects the lower lobes. Why not C? Paraseptal emphysema is associated with spontaneous pneumothorax in young individuals. Why not D? Bronchiolitis obliterans is a restrictive disease, often post-infectious or associated with lung transplants. Clinical Vignette 3, Alpha-1 antitrypsin deficiency versus smoking-induced emphysema. A 45-year-old man presents with progressive shortness of breath. He has never smoked but has a family history of early-onset lung disease. A CT scan shows bilateral lower lobe emphysema. Lab testing reveals low serum alpha-1 antitrypsin, AAT, levels. Question: what is the pathophysiology of this condition? A. Increased neutrophil elastase activity. B. Fibrosis of the alveolar walls. C. Hyperplasia of goblet cells. D. Decreased airway resistance. Correct answer: increased neutrophil elastase activity. Explanation: AAT deficiency leads to unopposed neutrophil elastase activity, causing Panacinar emphysema, primarily affecting the lower lobes. Why not B? Fibrosis is characteristic of restrictive lung diseases like pulmonary fibrosis. Why not C? Goblet cell hyperplasia occurs in chronic bronchitis. Why not D? Airway resistance is increased in obstructive diseases, not decreased. Clinical Vignette 4, Radiological features of COPD. A 72-year-old male presents with worsening dyspnea on exertion. He has a 50-pack-year smoking history. A pulmonary function test confirms an obstructive pattern. A chest X-ray reveals hyperinflated lungs, flattened diaphragm, and increased AP diameter. Question: which radiological finding differentiates chronic bronchitis from emphysema? A. Increased bronchovascular markings. B. Flattened diaphragm. C. Hyperinflation of the lungs. D. Increased retrosternal airspace. Correct answer: A. Increased bronchovascular markings. Explanation: chronic bronchitis shows increased bronchovascular markings due to airway inflammation and mucus production. Emphysema, on the other hand, presents with hyperinflation, flattened diaphragms, and increased retrosternal airspace due to alveolar destruction. Why not B? Seen in both COPD subtypes but more pronounced in emphysema. Why not C? Hyperinflation is characteristic of emphysema. Why not D? Increased retrosternal airspace is seen in emphysema due to lung overdistension.